All right. Good afternoon or morning to everyone, depending on where you are in the country. Welcome back to our Learning Collaborative. We are excited to continue the conversation today about the national strategy and how your work with the Lifespan Respite Grants fits within that. So we're going to just kind of do a quick overview of the agenda to get started, and then I'm going to quickly hand it back to Jill after that to share some updates.
I'm going to share the screen so we can see the slides.
Perfect. Right, and I think the agenda is on the next one. Perfect. Okay. So I'm going to hand it back to Jill in just a minute to share a little bit about the new funding announcement for the Lifespan Respite Care programs. And then after that, we will switch to just kind of checking in to see how everyone's feeling after our February meeting. I know there's a lot of information about the national strategy, and so just kind of want to get a sense from you where your states are at and have some discussion about any questions that you may have lingering from that meeting. And then Jill sent out a working document that is a table of how we see current grant activities that you all are doing all across the country aligning with the goals and outcomes in the national strategy. And so we're going to use this document quite a bit as we meet over the next several months and make sure that we're kind of helping people see like how these outcomes can be interpreted, how they might be implemented in different ways currently, or new ideas you might want to explore. So we'll walk through that and then we'll do a wrap up and next steps. So with that, I will hand it back to Jill to share a little bit more about the funding announcement.
Thank you very much, Megan. I would invite all of you to, you'll have a chance, hopefully, once we get into the discussion phase, to unmute yourselves and introduce yourselves more fully. But please go ahead and put your name and your state into the chat, and just as an introduction and a welcome to everyone so we can know who's on the call. I just wanted to make sure that you all saw yesterday, and I did send around a notice of the new funding opportunities on Lifespan Respite Care that ACL released yesterday. These are the links to the notice of funding opportunities. And just to point out that the deadline for applications is May 15th. There will be some informational phone calls related to both of these awards, and those dates are included in the funding announcement itself with the phone number to connect to those informational calls. And then, of course, a letter of intent due March 27th for both of these awards. Please note, and I'm sure you'll be hearing more about the fact that that does not have to be an intensive letter of intent. It's just basically an email to Emily that says, yes, we're interested in applying and probably will. And it doesn't commit you to applying, but it just gives them a heads up of how many reviewers they'll need at the end of the process and all of that. So don't worry too much about the letter of intent. It's really just a quick email to Emily. I'm going to, in the next slide, briefly review some of the references to the national strategy in the notice of funding opportunity, just so that you're aware of them. Please keep in mind that as I go through these quickly and you have questions, I will not be able to respond to them. If you have questions, you must direct them to Emily Anozi, who is going to be the primary contact for these funding proposals at ACL, and she can answer any questions that you might have about the funding opportunity announcements. Most of what I'm going to be talking about and reviewing today can be found on pages 5 to 7 of the notice of funding for state enhancement grants. And I think for most of you, this is the funding opportunity that if you are pursuing, that this is the one that you'll be responding to. The other announcement is for new states that have never had a previous Lifespan Respite Care grant, or may have had a grant early on in the first years of funding, but their state systems lapsed or their activities lapsed, and they would like to start over as a new state. Only ACL expects to only fund one state in this category. So I don't think it applies to most of you, but I want you to know that it is out there. So in terms of the highlights in the NOFO that I just want you to be aware of, in addition to discussing the role of COVID in reshaping the environment in which lifespan respite programs exist, in its description of the evolving respite environment, the notice of funding, which I'm now going to refer to as NOFO, because that's the new acronym for these, what we used to call FOAs are now NOFOs. It makes reference to the national strategy multiple times, and especially how the national strategy helped highlight the importance of both cultural and linguistic competence in respite services and the growing direct care workforce crisis. It goes further to say that with the NOFO, there is an opportunity for states, and I quote, to rethink their respite system and use the strategy as a roadmap for program planning and execution. They suggest that applicants review the policy brief that ARCH released last month at our launch of this learning collaborative on the role of respite in the national strategy. And I've included the link to this as well. And I will, just to let you know, as soon as I'm done with my short presentation on this, I will put all the links that are included in these slides into the chat. And you'll also be receiving a copy of the slides after the meeting. As we're doing through this learning collaborative, the NOFO encourages applicants to become familiar with the goals and outcomes included in the strategy, just as we're going to be doing today and in the weeks that follow. But it particularly cites as an example under outcome 3.2, and you'll be seeing all this in the matrix later, family caregivers can obtain respite services that meet your unique needs. And it states that high quality respite is one of the most requested needs of caregivers, but gaps in the availability and affordability of access are significant. And then finally, to address the direct care workforce issues, the NOFO refers applicants to the brand new National Center to Strengthen the Direct Care Workforce. That resource center the effort is being led by the National Council on Aging, but they have many, many partners. And they refer you to the National Center to access best practices, training, and technical assistance. Unfortunately, at this point, the link that you see here takes you to the ACL webpage that just describes the National Center. It's so new that I don't believe the National Center actually has a website yet. But as soon as it does, or we learn more information about that, we'll make that available to you. The NOFO goes on to suggest that applicants discuss how they will promote equity through service access and flexibility to allow caregivers and recipients to be provided respite services grounded in cultural awareness and competency. And on this topic, they reference one of the volumes in the national strategy. And if you recall, there are actually 4 volumes to the national strategy. It's not just one document, but one of those documents is called First Principles, Cross-Cutting Considerations for Family Caregiver Support. And these are the 4 principles. They're displayed here on the slide. Place the family and person at the center of all interactions, address trauma and its impact on families, advance equity, accessibility, and inclusion for family caregivers in underserved communities, and then finally elevate direct care workers as family caregiving partners. And these are the 4 overarching principles that overlay the entire national strategy. And within each of these principles in this document, ACL and the councils identified essential practices that can support each of these 4 core principles. And these essential practices are described in detail in the document. And again, so the NOFO specifically calls out this document for you to review and think about addressing in your proposal. So to recap, it's really ACL's expectation that applicants will fully describe how they will use some of the approaches outlined in the national strategy to support family caregivers in this first principles document that I have up on the screen. And also there's another, one of the volumes is called Actions for States, Community, and Others. And that's the document that we're primarily referring to in this learning collaborative. And to use these as a roadmap or a guide to enhance and advance your state lifespan respite system. And to figure out how this work aligns, you know, the work within the national strategy will align with enhancing your lifespan respite systems. So I know that was a lot to throw out to you, especially without my ability to answer any questions. If it raised any questions for you again, please be sure to email those to Emily Anozi, and I will put her email address in the chat as well. Before I go on to the next slide, I noticed in the chat that, you know, from the last meeting, that there was quite a bit of interest that emerged about mobile daycare services that Wendy Fox-Grage from NASHB mentioned as a model in her presentation on the national strategy. And I wanted to quickly just tell you what I know about that model. And we can pursue this more if there's still a great amount of interest. About 15 years ago, Arch learned about this service that was being offered through the area agencies on aging in Georgia. That was funded by the Administration on Aging's Alzheimer's demonstration grants and the Alzheimer's Association. And it became a national best practice that was widely touted by AOA. And we were excited to learn that, I think it was somewhere around 2012, that the Oklahoma Lifespan Respite Program had awarded a seed grant to an adult day program to provide mobile adult day services in 4 very isolated rural communities in Oklahoma. And this was also a model that got cited quite a bit. The Lifespan program partnered with the Oklahoma Department of Transportation to access a van that was still running, but would have been taken out of service by the state. And the van was used to transport trained staff to rural areas where they would provide adult day services in churches or in senior centers. And this very resourceful respite service was really the only opportunity that many caregivers had to get a break in these rural areas in Oklahoma. And we featured this Oklahoma model and the Georgia model in our fact sheet on rural respite that we published way back in 2012. And we're updating that fact sheet now. So hopefully we'll get some more information about this model and some other models. But it's my understanding that the Oklahoma program was only sustainable for a few years until the upkeep and operating expenses of the van were no longer feasible. And from what I've been able to find out in a little bit of research I've done so far, there still may be one area agency in Georgia that's offering mobile respite, and I'm trying to track down more information about that. I did find a fact sheet from the Georgia Department of Human Services from 2010 that provides more detail about the program and how it was running back in the day. And I'd be happy to share that with everyone. I'll try to upload the document into the chat, but if I can't, I will send it around to everyone afterward with all the other resources from today's meeting. I did follow up with Wendy as well at NASHB to see where they learned of the model. And she said that they had learned from their examination of requests for information from states and individuals that the PACE program, and there's Wendy right now, the PACE program had funded some mobile adult day services during COVID. And she was also aware of some other adult day services that made this model more available during COVID. So I have already reached out to the National Adult Day Services Association and to the PACE Association to see if any of these models are still up and running. And if so, how are they being sustained? And perhaps if there's interest among all of you to learning more about this model, we might even be able to dedicate some of our time to learning more about it and how it's functioning and how it's being sustained. Again, all the links that I've mentioned, I'm now going to put it into the chat, but I'm going to turn it, unless anyone has any programs right now about that particular model. I can't answer questions about the mobile model if you have any. And please unmute yourselves because it's hard for me to see everything in the chat. We have some interest. Any questions? Okay. So we'll move. I'm going to hand it back over to Megan, and I think we have a poll we're going to launch. Are you ready for that, Megan?
I am. Thanks, Jill. We actually are going to have a couple poll questions back to back here. So we just wanted to get a sense of how you all are feeling after you've reviewed the national strategy, specifically the respite recommendations. This group is here to support you and create conversation. And so we want to just make sure we have a sense of how you're feeling and adjust our planning accordingly.
Give you another few seconds to vote. Please select the word that most fits with how you felt reviewing the national strategy's respite recommendations. You can also elaborate on that in the chat if you like.
Yes, and we also recognize that you may be feeling more than one of these things. That is very normal, but it looks like we've got quite a bit of excitement and some overwhelm, which I think is very reasonable, and that's really helpful. So thank you for sharing that. Again, we recognize that this may feel both exciting and overwhelming, and hope that we can create opportunities for discussion and resource sharing that really help maybe reduce the overwhelm a little bit, but also that we can continue to build momentum and keep that excitement going. We can go to the next poll, Jill, when you're ready. Okay, so the second one, and it's okay if you may not know the answer to this, but the second question is, on a scale of 1 to 10, 10 being the highest, how do you feel about how your current respite grant activities align with the respite recommendations in the national strategy?
And you can actually, if you scroll down, you can see all of the numbers 1 through 10. So you can select where on the scale you feel your response would lie.
Give you just a couple more seconds. Looks like so far we're quite a few kind of in that middle toward 7, 8 seems to be the highest.
Results. Can you see all the results?
Yep, I can.
There's nothing lower than 3. So
yes.
It's a nice bell-shaped curve.
It is. And again, I think this is exactly to be expected. And hopefully the table that we show you today will continue to help you see some alignment, but also maybe some potential opportunities that you hadn't thought about before. So thank you for taking a couple minutes to do those polls. This is really helpful. We want to continue to check in with you and make sure that we are responding to what you need in your area. So with that, we're going to just open the floor for discussion for a few minutes and just see there are any questions or comments from the presentation last month, or as you've reviewed the national strategy. And then also if you have, and it's absolutely okay if not, If you can share in the chat or come off mute how your team or your state as a whole has started to think about how your work does tie into the national strategy. We fully recognize people may be in very different places with this. So if you're like, oh my gosh, we haven't even started, that's absolutely okay. But we just want to get a sense of where you are and how things are going. So I'm gonna mute myself. And if anybody wants to come off mute, we'd just like to have a few minutes to share.
Megan, this is Sarah from Idaho. I think what I'm sensing is a continued struggle with historical siloing of supports and services. You know, a real resistance and maybe inability, you know, for lots of reasons. But just being able to think lifespan within systems that have been traditionally bound by age, disease, condition, you know, those sorts of things. So that's what I'm seeing or feeling.
Thank you for sharing that, Sarah. That I imagine you have some other people that's a familiar place to be in. So thanks for sharing. Cheryl put in the chat from Nevada. We recommended state legislation to get process of caregiver assessments in place. That's exciting. And the bill is being heard tomorrow. Well, congratulations on that effort, Cheryl. Thank you for sharing that.
Good morning, everyone. This is Lita Nelson with Arizona Division of Aging and Adult Services. I just wanted to say that, yes, Sarah, I totally see that siloing of services as well. Right now, we're just opening up discussions as to who does what kind of respite. We're finding that respite care is definitely tied to funding streams and eligibility requirements for those funding streams. For instance, Children for Children, individuals living with disabilities, you know, stroke, dementia, Title III, you know, lifespan respite kind of moves across the spectrum from, you know, across the lifespan really. So, and then we're also finding that the lack of understanding of exactly what respite care can be, what that looks like. It's actually just really a lack of understanding of caregiving, family caregivers. I find myself in discussions with other leaders, with other, you know, individuals that don't quite understand family caregivers. They want to put in place, you know, just barriers to services that are meant to be helpful. But we're asking 80-plus-year-old people that are taking care of other 80-plus-year-old people to do A, B, C, D, E, F, you know, so on and so forth. It's not attainable for some people. Some people just stop making phone calls. There's lack of, you know, talking to each other as different organizations and agencies. And then we do find, though, also that some entities may feel a little bit protective of their people, although, you know, it's something that may be helpful to them. But we are definitely exploring different options. And Yuta Oilik is also on the line from Arizona. I don't know if she has other thoughts as well.
Yeah, good morning. This is Yuta. No, I agree with Lita. I'm gonna turn up my volume a bit. You know, the siloing is an issue, but it can be addressed. And so Arizona, for example, we're a grantee of the Community Catalyst grant to work with caregivers on advocacy issues. And we are spearheading a committee to review the national strategies and draft a strategic plan for Arizona on caregiving. And so we are working really hard, and I think we were on the right track here to bring in individuals representing the intellectual and developmental disabilities community. We have the cancer caregivers. We now have somebody from a dementia-specific organization. And of course, we have the area agencies on aging and the Alzheimer's Association Desert Southwest chapter involved. So we've spent quite a bit of time bringing these organizations together. And at the very beginning, we pretty much cut short those questions that popped up. Well, what's a caregiver? Who's a caregiver? Are grandparents caregivers? We just didn't want to go down that route. And so we're really finding that there is some overlap. And, so I would encourage others to do the same thing, find those different partners and try to bring them to the table and just start bridging those gaps.
Thank you, Lita and Yuta. That's very helpful to hear how things are going in Arizona. Amy from Massachusetts put in the chat, in the 12 years that we've been a lifespan respite grantee state, I've seen a significant change in the awareness of the importance of respite and family caregiver supports on the national and state level. Hopefully this will continue in Massachusetts after the ARPA or the American Rescue Plan funding that we have that currently ends in 2025. But with that being said, siloing is a pretty significant issue. Amy, I'm sorry to put you on the spot, but I'm curious if there's anything with that funding that you feel like has changed, who you've been able to bring to the table and how that might be leveraged for the national strategy.
So we actually are in the process of, we were very fortunate because our ARPA steering committee in the state was able to prioritize some competitive respite innovation grants with a pretty significant amount of money, much more so than we've ever seen before, across populations and across agencies. So those grants are about to be awarded. And so that's definitely going to be a great opportunity for us to bring in some more stakeholders and some more partners. We already have a pretty solid state action group with most of the major human service agencies represented, but this is going to, I think, bring it to another level. So it's very exciting.
Yeah, that's fantastic. Thank you for sharing that. I think that's a great example of leveraging. A lot of states are juggling different funding sources, different resources, and I think just different awareness of caregiver needs and respite needs in general. And so seeing the creative ways that states are using those moving forward. Any other comments from the February meeting, or just kind of where you are with your state as you're thinking about how your current work and future work aligns with the national strategy?
This is Dina from New York. I just wanted to share, Megan, interestingly, we had our MSW intern take the document for the action steps for states and locals and kind of put together, just some of the work we're already doing, identify some of the gaps because we knew there'd be another funding opportunity coming. And I think it's going to actually have further utility in our master plan for aging work because we've been informed that we are breaking into many different subcommittees, one of which for caregivers, informal caregivers, and then one for formal caregivers. And myself, I'm a co-lead along with a counterpart at the New York State Department of Health, but there are going to be many different work groups established within each of the subcommittees to really focus in on, developing this master plan. And it is a 2-year project. So I kind of feel like that the timing couldn't be better, just because I feel like now we have, like all of these other systems kind of being forced to the table to have these discussions and, having almost like, this strategy to present and kind of share, okay, like, this is what we're doing, where can you add to this document? And then where can we as a group, like kind of identify ways we could do things better, right? Or do things differently. And a learning opportunity, because there's probably a lot of things that, because we are so siloed in certain areas still, of being able to kind of learn from each other. So we're really excited. I think that I'm glad that we got a jump start on that work. We didn't intend for it to be for that purpose, but now I feel like it's going to be really, I think, very valuable. So yeah, so I just wanted to kind of share where we are here in our state.
Yeah, thank you. That's great to hear. And I think that exercise of really kind of crosswalking, like, sometimes it is a matter of just putting things in a document, and that's kind of what we did with the table we're going to show you today. So for states who haven't done that, to say where do our activities fit, it sounds like that's been very worthwhile for you all in New York, and maybe a good starting place for states that are kind of trying to wrap their heads around how do we approach this. So appreciate you sharing that. And I'm glad to hear the timing is aligning so nicely. That's always the way that you want it to go. Anyone else?
It's Lisa Schneider with Respite Care Association of Wisconsin. I just wanted to share something that was just really super easy for us to do in regards to a lot of people refer to underserved populations, but really don't define them. And in one of the reports that was released by the group, the first principles cross-cutting considerations for family caregiver support, they identified what they deemed to be the underserved populations. And so we created a document and adopted it as policy that these were the how we were going to track how we're serving underserved populations. So anybody who utilizes our programs, we use the underserved population categories as a way of seeing who we're being able to support.
Great, thank you for sharing that, Lisa. I think there's both a request for New York, but I think this goes more broadly. If any states have templates or language or anything that they're doing that they want to share, certainly feel free to send that to either post in the chat or send that to me or Jill, and we can make sure that those are shared more widely. I think absolutely there's a huge opportunity to learn from each other and not recreate the wheel when states have had great approaches.
Yeah, I would reiterate that. I mean, there are already 3 or 4 things I see as potential presentations we can have within this learning collaborative. Amy in Massachusetts, I think we'd be especially interested. I have heard a little bit about the huge call for proposals that went out for Respite in Massachusetts, which is tremendously exciting, using those ARPA funds. And that might be worthy as that initiative progresses a little bit more in Massachusetts and we see what gets funded. It might be interesting for you to share more about that in the future. But so much going on already in the States, even as we move forward through the learning collaborative.
Yes, this is very exciting to hear what you all are up to. I'll make sure we have enough time for conversation. So last call if anybody else wants to share. Okay. Well, with that, we are going to continue the conversation, but switch into the table that Jill shared with the agenda. So Jill, I think we can go ahead and just switch over to that document. So this is going to be a document that you're going to see often, and we will keep updating, and wanted to just have something that we could all look at regularly, to be thinking about like how each of your states individually can see your work fitting into the national strategy, but then how like the network of all of you is working to address the strategy and the recommendations as a whole. And the good news is there's a ton of work that many of you are already doing that I think aligns really nicely. So we are going to walk through, it is a fairly long document, but we're going to walk through each goal and outcome. If you see things in your state that you would like us to add, feel free to come off mute or put them in the chat. This likely, we probably are not going to be able to list every single thing every state is doing. Yeah, Jill, if you could make the text a little bigger, that would be great. But if there's something that you feel like, oh, we're doing something unique and we really want to make sure to add it, I think, as Dina mentioned, like doing some sort of kind of crosswalk like this in your own state might be a good starting point if you haven't done that. And so certainly if this type of table feels helpful to you, please feel free to utilize it for your own state efforts. You're going to see that there is a column on the right that has very little in it intentionally, and we hope to be adding to that as we continue to meet and thinking about, you know, as you're working on, you know, future planning, what else might your state be interested in trying that could align. So the second column is what we'll focus on today, things that states are already doing. Most of the, or a lot of these are current. Some of these may be a few years old. Yeah, we'll just kind of dig in.
I also want to clarify that some, we pulled some of this from our summaries that we did of your reports from your 2017 grants. Again, so things that you may have done and are no longer doing. We also pulled, however, from your current grant proposals that you were planning to do. So if they're no longer part of your work plan, it might be helpful to know that too. Or if you see any mistakes in here about things we've reported on, let us know that as well. And can you see it a little bit better now? Megan, is the print?
Yeah, I think we're good. I think we're good. But if anybody's having trouble seeing, please come off mute and let us know.
I also put the link to it in the chat. If you want to just pull it up on your own computer screen, you should be able to do that from the link in the chat as well.
Yeah, and there are, as you can see, there are links to quite a few of these activities. So if you actually want to know more about those activities in general, definitely recommend you check those out or reach out to the state that is doing that work. So again, we're going to just talk through this. Anybody feel free to come off mute or in the chat if you have comments or corrections or we missed something. There's a lot of great work happening. And so we know that we probably didn't capture all of it. So the first goal is really about increasing awareness of and outreach to family caregivers. And so we'll just walk through each outcome. Outcome 1.1 is Americans are educated about and understand the experience of family caregiving. And so we've saw, I mean, I think nearly all, if not all states are certainly thinking about this. So that's been everything from pretty big public awareness initiatives and campaigns. You can see a few examples of these here. And then as well as outreach to the underserved populations. We just heard Wisconsin talked about how they're, you know, really just determining what that means, as well as professionals. So trying to just increase the broad public awareness. Lisa, that's a great question in the chat. Lisa asked, do you only want activities toward these strategies, goals, and outcomes that are funded with federal lifespan respite funds, or do you want to capture activities that are not funded with federal? Jill, correct me if you feel differently. I would say all of the above. I mean, certainly we want to make sure we're capturing what you're doing with the lifespan respite funds. But I think also there may be things that are being done through other funds that you're blending and braiding that may be relevant to capture.
Or perhaps activities that you're funding with other sources of funds, but might be good activities to expand on with your lifespan funds or target a little differently.
Absolutely. Yeah, I would definitely say think broadly, particularly as we're hearing about how states are kind of starting to think about how this work might tie into broader state strategic plans. Yeah, think big here. I think Jill, if you want to scroll down just a little bit. Nope, sorry, I thought it went further down. Are there any, I'm not going to stop for each of these, just given the number of them, but again, if there's anything that you feel like we're missing, that one, I think this whole goal in particular is such a priority area for a lot of states that we know that you're doing a huge number of different things to increase awareness and outreach. 1.2 is caregiver self-identification and knowledge of services is enhanced. So we looked at how several states, which you can see listed here, are utilizing their no wrong door systems to try to increase referral connections and access for families and referral sources. Idaho is also referenced for how they've been partnering with Medicaid on their Idaho Family Navigator. 1.3, outreach to family and caregivers is improved. So again, I think similar to 1.1 and 1.2, we've got several states that are doing ongoing public outreach efforts through their website, social media, building relationships and just awareness of trying to break down those silos across the lifespan. Some states have also even done like radio and TV and online ads and things like that. And then Montana created a database of respite referral sources. 1.4 is family caregiving and caregivers are embedded in federal, state, territorial, tribal, and local planning. So we've seen quite a few different approaches to how this has been done, including a state level task force, actual state legislature, designation of ongoing funding, and then as well as enhancements to referral processes and services. So hopefully as we go through this, you're seeing that there are, as you know, there are so many different approaches to these, and we really want to highlight the diversity of what states are doing, because you all know your states better than anybody else, and there is not a one-size-fits-all response to any of these outcomes. 1.5 is all about public-private partnerships and trying to help, again, build awareness of family caregivers and the recognition and support for them. So we've seen there's a lot of interest and a lot of great work that's been happening around employer engagement and recognizing that there are a lot of working caregivers, and how can employers be brought to the table and be part of the conversation about supporting them. So there's a caregiver-friendly workplace toolkit. We've seen a few states that have used surveys with employers to really try to understand caregiver needs and go in and do lunch and learn type things, referral cards, just get some information out. Oh, thank you for the correction on Oklahoma for 1.5. We've got Oklahoma has not been doing lunch and learns, but are looking to integrate technology to include coalition caregivers and anyone with interest. We will make that correction. Thank you. That's exactly why we're doing this.
Helena, do you want to jump off mute for a minute and just tell us a little bit more about that? I think incorporating technology, there's another whole section of recommendations around technology that we don't really even have on the matrix to a great extent. So I'd be really interested to hear more about this.
Well, great. So, you know, when we were going over this and looking at it, we realized that, you know, due to COVID, we have not done the lunch and learns and done it in person. And it has just kind of become a thing where we find a way to, I almost feel like by hosting those, we are not incorporating each corner of our state. So if we use technology and do things such as Facebook Lives and give opportunity for people to share what they would have shared in those lunch and learns, we are not only just serving the local businesses or the coalition members, but if we do it on our coalition website, we have caregivers that follow, and we'll be able to reach them. And I think the reach will be greater. And we've got a person hired whose focus is mainly using technology and leveraging the socials to make sure that we are reaching everybody, and everybody that has a connection with a caregiver. So we're reaching humans.
Thank you for sharing that.
I think as Jill said, I think that could fit in a couple of places, but that sounds like a great pivot to trying to expand reach. So we have a few outcomes that we would like your examples if you have them. So goal 2 is, well, I guess I should stop and just see, does anybody, before we switch to goal 2, any other thoughts or comments or corrections on outcomes 1.1 through 1.5? Okay, I think we're good to scroll back down to goal 2 then. Goal 2 is advance partnerships and engagement with family caregivers. And again, I think we tried to pull in examples wherever and we could, but recognize that there may be some things we don't know about or missed. So thank you, Lisa. I just saw your comment about submitting additional activities that you'll submit for our consideration to the matrix. Please do feel free to email either Jill or myself, and we can take a look and figure out where we see activities fitting in here. So outcome 2.1, we would love to hear if you feel like your state is doing this and want to add anything. It is family caregivers are recognized as essential partners in the care teams of the persons to whom they are providing support.
And I think this may have had more to do within the national strategy, and I could be wrong. And those who know more about the original intention of this, I think it was focused more on essential partners in healthcare services, but it certainly applies to all of us working to support family caregivers and making sure that caregivers are partners in this effort. And I know a lot of you are trying to do that through your state respite coalitions by engaging more family caregivers to participate in your coalition activities and events.
Yeah, Jill, you're right. That was the intent of 2.1, but we are really interested in best practices of any kind of linkages with the healthcare system.
This is Dina. I was just going to share, I know, I don't know if this would fit per se, but we had shared, I think, on a couple calls, just as an example. We have one AAA, and I think that there's been a few more that have replicated, but they put together a whole packet for the caregiver, for discharge planners to be able to kind of disseminate when they identify that there is a family caregiver involved, to get them connected back to the caregiver support program. And that was part of the whole, no wrong door, and it was going very well. And so I know we had gotten those packet of materials to kind of share as an example of the best practice.
Thank you so much for reminding me about that, Dina. I was actually thinking about that when I was pulling the matrix together, and I had it on a note and I was going to stick it in somewhere because it is such a great example of what you've all done to connect to that transition from hospital to home work that all of us have been struggling so much to figure out how to do.
And I will share that it's very new, but with our pilot project with T-Care, we actually had a medical center reach out to us in Buffalo, and they were interested in having their social worker be trained and use T-Care to have that transition back to the community go smoothly. So they actually became involved with our pilot project, and it was very successful that they went ahead and applied for grant funding, and we were just notified yesterday that they did receive the grant funds. So they're going to continue with the relationship with their local office for aging, basically to kind of have that process more formalized and provide that support with the transition back home. So we're excited. We said as they get further along, we really think that others will want to replicate that as well. So we're going to try to highlight that for people to hear about.
That's fantastic. Thanks for sharing that. You're getting some kudos in the chat and on the screen. So great work. We will definitely make sure to add those examples from New York. And again, once you've got copies of this too. So if you think of things that you want to add from your states, please let us know. And it's okay if some of these are going to have more examples than others, which is to be expected. And that's why we have the column to the right, which we will pivot to in future meetings of what might be done. So outcome 2.2, where appropriate, identifying services and supports needs for caregivers consistently starts with a review of family caregiver strengths and preferences using evidence-based assessments. And we've got, I think, several states using different caregiver self-assessments. We heard the mention of T-Care. We've got some other assessments going. So some good examples of that in states.
We'll have to add the the new model when the legislation passes in Nevada.
We will, we
So
will.
keep us up to date on that, Cheryl.
Okay. Outcome 2.3, where appropriate, family caregivers are included and considered in the development of care recipients' plans of care across a range of settings and circumstances. This one is less specific, but we recognize that many of you and your coalitions are actively engaging and encouraging family caregivers to participate in coalition activities. So again, if you have other more specific activities that are a good fit with this, just let us know and we can add that.
And again, the example we have here doesn't perfectly align with
Right.
this outcome, but gives us a chance to talk about how we, in the work that we do, how we engage family caregivers.
Yeah, exactly. I think we are trying to make those connection points as clear as possible, but again, implementation looks a little bit different in different programs. 2.4, this is another one where if people have examples, we would really like to hear them. When policies are proposed or revised, the potential impact on family caregivers is anticipated and understood. That may be one that we spend some time thinking about, how could that, what have you thought about that could help address that? That's certainly I think an ongoing challenge for a lot of states. 2.5, the education curricula of professionals who will potentially work with family caregivers include specific topics and coursework designed to ensure that they have the skills to do so effectively. We have a lot of examples of this, which is great. And I imagine this one will be evolving as well. We've got the Wisconsin free trainings that they offer online, several other respite provider trainings and curriculums, including the multiple states participating in a field test. And then we've also referenced Kansas and South Carolina's. Wendy, I saw you come on, bring your camera on. Did you want to say anything?
Yeah, I was going to go up just to the one above that on 2.4 because it's sort of vague. That I can give you a little bit of background on that. That actually came from the raised faculty. And I think that had to do more with hospitals, like when they change plans, when they change their policies, like to think about not only how it impacts like the person in the hospital or a member of a plan, but their families as well, since it has impact. Okay, great. Thanks for that context. So again, primarily within the healthcare setting is what we're thinking. Right. Yeah, most of 2 is within the healthcare system. Okay, perfect. Yep. Appreciate that context. I do want to know Amy's comment in the chat on 2.3. I was just wondering if the CARE Act is still in existence. I remember pre-COVID when this passed in many states and the focus was on engaging family caregivers and planning. And is that a possible area of alignment?
Yeah, I think it's, so I'm sorry, go ahead.
Sorry, it just popped into my mind. It kind of got lost in all the, at least in my awareness with, everything that happened around COVID and the CARES Act, right, which is different. But yeah, I was just curious where that stood because I know that there was a big push several years back on that being passed. So I'm just curious.
So to clarify, you are talking about the CARE Act state legislation that AARP was promoting.
Yes, that had to do with engaging family caregivers and planning when loved ones were stepping down from hospitalizations and rehab, I think, if I remember.
Right. I mean, that's kind of what that was what Dina was talking about earlier with with their 1AAA developed that package that could actually be used by the social workers in the hospital when they were helping someone transition from hospital to home. And I think many of our other lifespan respite grantees have also tried, and why Dina shared that package with us some time ago, because we did have a number of grantees that are very interested in making sure that they are involved in the hospital setting. I mean, that's why included goal 2. At first we left it out because we didn't think it had really respite implications. But I think it really does, because so many of you are trying to interact with the healthcare settings, with hospitals, and try to at least get information about caregiver support and respite as part of those systems change within healthcare settings to be happening. And I know with the CARE Act, Wendy probably knows more than I do about this, but I think that 40-something states did pass CARE Act legislation. I think the success of it is quite variable, because hospitals were not always so supportive of moving this forward, because there wasn't always funding around it for them to implement those transitional supports. But it certainly was a very important policy change that I think continuing to be implemented and improved upon.
Thank you.
This is Dana in Washington, and Washington actually passed it in legislation, but they have never enacted it. So I would love to work on how to get people to speak out for that to be enacted, so that we can start planning for that.
Thanks, Dana. As Jill alluded to, I think I think the healthcare initiatives that people are thinking about or have already done, we weren't totally sure how some of those activities fit directly with some of the outcomes. And so once we get through the rest of the table, that's going to be a question for today, and probably an ongoing question is, what other work do you feel like needs to be reflected, but it may not directly connect to one of these outcomes, and how do we want to tackle that? So I think goal 2 is particularly an example of that. I did want to note that Rosalind shared that Washington State has been working on a kinship navigator pilot research project. It uses a needs assessment with kinship caregivers. That's exciting. Thank you for sharing that. We can get that added. Okay, I think we got through 2.5. Okay. Anything, I know we're going through this quickly. Anything else on goal 2 before we pivot to goal 3? Okay.
So this is Lita with Arizona. I just want to throw out there really quick that we've been working on also aligning goals with the state plans on aging. So we are trying to make sure that, family caregivers are well represented within that goal, within those goals and objectives, and also aligning also, of course, with the national strategies. And also, so there's a number of different things that are going on. And in Arizona, the Department of Health Services recently received a grant, Arizona Health Improvement Plan, which has a caregiver component. So they are actively making sure that caregivers are represented within that group, and it's in its initial stages. So this is definitely something that, we can direct them to, as far as there's already work happening with the respite, side of caregiving. So thanks.
Yeah, absolutely. Thanks for sharing that.
Yes, and I'll add, this is Lynn Gall from Wisconsin. I see so much, I oversee the family caregiver support programs as well as lifespan respite, and I see so much that we are already doing or have done that's not included in this list that we could add. If you're not looking for just lifespan respite funding, that's doing it. I think there is much going on that we could share. And I know Lisa put a comment in that we will submit things later, but I guess that's kind of a little bit of my question, being somewhat new to the lifespan respite part of this is, I know earlier you said not just to look at the lifespan respite, but where do you kind of draw that line if we don't want to be siloed as far as what we're collecting in this collaborative versus the whole larger, strategy?
I mean, I would say the more the better, and it may or may not, depending on the final version of this document, be in there, but I think it's certainly good to have, and we can think about how else that can be captured. I think there, at some point, we may have to draw the line solely to just not have this be a too lengthy of a document, but absolutely want to hear, how are you blending and braiding funding, and how are you leveraging the foundation that you may have built through your lifespan respite grant. We certainly know that there are examples of states where something either started as a lifespan respite activity and then maybe was expanded or scaled with some other funding, or the opposite. It could be brought in as more of a lifespan respite activity. So I would say we can worry about the sort of sorting and how it, where exactly it fits, but it's better for us to kind of see the big picture. So
Okay, so we'll just
feel free
share
to
it.
share.
And we can decide what to do with it. Okay, sounds
Yeah.
good. Thanks.
Absolutely. Yeah, we know that it would be, we could probably write a novel of all the great things that are happening in states that fit on these. So if we forgot something, it likely is just, it just got missed in the shuffle. And we really do want to have a comprehensive look at what your states are doing.
And we do want to be sure that as a group, we're promoting respite actions broadly.
Right.
We certainly want to assist all of you in implementing your lifespan respite programs. And again, we hope that given the fact that you're all in a position of building or enhancing statewide coordinated systems of respite, that even though your funding through lifespan is very limited, that you're in a great position to bring all of these activities that you know about together in a more coordinated way. And if talking about them and sharing them helps do that, that's part of what lifespan respite is. It's not just about what's happening with lifespan respite dollars. It's about what's happening with respite in your state and how do we better coordinate them so family caregivers don't have to worry about where to go and how to access them. So the more information we have, the better systems you'll be able to build at the state level and be a leader in developing that coordination effort. Does that make sense? I know that's a big task to ask of you, but
You got a thumbs up, so I think so, Jill. Okay, so goal 3 is about strengthening services and supports for family caregivers. 3.1 is about person and family-centered, trauma-informed, and culturally appropriate caregiver services and supports are accessible for all family caregivers. We have some great examples of this, including Washington's Tribal Kinship Navigator program, the Spanish-speaking navigators available through the Idaho Caregiver Family Caregiver Navigator, the way that people are engaging different populations in outreach and just how we're talking about respite. I imagine there are probably many more things that we could be including on this one. So definitely let us know what we are missing. 3.2 is kind of following in that, and that caregivers can obtain respite services that meet their unique needs. I think voucher programs are the most obvious connection point here. We know, we talked about this last time, a lot of states that are doing respite voucher programs and particularly doing self-directed respite voucher programs. So families can make the right choice for them about who the best provider for their needs is. We also talked already about the no wrong door systems, just to continue to try to help meet families' needs. And then we've got New York's Caregiver and Respite Wellness Center.
also, as you're hearing about these activities, if there's something you want to learn more about, let us know that too. We can, dedicate all or part of one of our meetings to investigating any of these initiatives in more depth.
Absolutely. All right, 3.3, a range of evidence-based education, counseling, and peer support services are available to family caregivers. Again, we've got quite a few different examples of these trainings, respite retreats, Alabama's work to increase emergency respite funds and provide no-cost statewide mental health counseling to caregivers. So I think that's another great example of the broad variety of ways that states are trying to tackle that issue.
We just did also, Arch co-hosted a webinar with the Break Exchange where we featured Alabama Lifespan Respite's caregiver mental health wellness initiative. So we already have lots of great information about that if you want to learn more about that. Just hot off the presses.
Great. Yeah, that one definitely caught my attention. So I imagine it might have caught a few others as well.
Oh, sorry about that. There we go.
3.4 is a little bit tricky, and you'll see this with a few others, in that it doesn't necessarily directly tie to respite, but certainly, it's family caregivers and families have safe spaces to live, nutritious food, and adequate nutrition or adequate transportation, excuse me. Of course, we know that all of, having your basic needs met affects people's quality of life, and certainly respite is a part of what families need. And so we pulled a couple examples, but again, recognize that this might be a little bit broader than some of your programs are thinking, but we know that Washington has done some work on a crisis to support a crisis nursery. And then I think COVID was really the biggest example of this, and the number of states in your programs that pivoted quickly to respond to changing family needs related to technology, transportation, food, and just figure out how to adjust your service models accordingly to meet basic family needs. 3.5, this is the technology one. So again, we've got, I think, some examples where things could fit in a couple different places, but we've got a lot of states doing interesting things so that caregivers can have innovative tools and technology, including actually distributing technology support like tablets, working with state partners on assistive technology programs to help make sure families are actually getting the tools that they need. Oklahoma's developed or is working on a respite app. So a lot of different examples on this. Oh, right, we've got a couple other examples. We've got, we also offer VR experience for care recipient empathy. That sounds very interesting in Alabama. We've got Arizona rolled out the True Alta program, which has been well received. And then on 3.4 could include mental health populations because respite becomes that safe space. Yeah, that's a good call. Nevada has a grant working on dual diagnosis to help create respite options for families where the silo approach doesn't work. That's definitely something we should add.
Yeah, at some point we may want to learn a little bit more about True Alta. I know New York is using that, I believe. I could be wrong. And North Carolina, I know, uses True Alta. And it's an online, kind of like a caregiver library where family caregivers can access lots of information about caregiving. And I think those True Alta programs are developed individually for each state to meet their particular needs. But there may be someone on the call that knows more about it than I do.
Dana and Lynn said that both Washington and Wisconsin use it as well. Some South Carolina AAAs are using it. Yep, it's made available to all New York caregivers at no cost. Yeah, it sounds like this is a really popular tool, so that may very well be a good presentation. Minnesota as well.
Chris, this is one of these proprietary things that gets a little bit tricky for us to promote, but we certainly can share information about it.
Yeah, absolutely. All right, I'm going to keep going through these since we've got about 20 minutes left.
Oh, sorry.
Oh, no, you're fine. There's a lot of content and I absolutely want to keep the conversation going. So please don't let that stop anybody from jumping in. 3.6, volunteers of all ages and abilities are trained, vetted, and ready to assist family caregivers. Again, a lot of great examples. People working with faith communities, people working with local university students. We've got some grants to fund this, some trainings and toolkits. Again, I think if this is something you're interested in, a lot of states have done some really good work that you can learn from in these links.
And also, if you're not already participating in our volunteer and faith-based learning collaborative, please join us. Everyone's welcome.
Right. 3.7, this is goal 3 is pretty big, so bear with us. 3.7 is family caregivers and care recipients' needs are a key consideration in emergency response efforts. Again, I think this one, we've certainly seen states doing it. This one's a little bit like, where exactly does respite fit? But we want to hear, and I think to Lynn's comment earlier, like this is a perfect example of there may be things going on in your states that you found connections to respite, but maybe don't fit exactly under your lifespan respite activities, but are still very relevant. So we've seen how Idaho's utilized their family caregiver navigator program through text and personal connections with family caregivers, really looking at how do you assess like personal crises with families. Emergency respite is definitely a big one. New York's working on an emergency preparation program for caregivers. And then North Carolina is doing a lot of outreach to help increase understanding about how to support caregivers in crisis. We've got the Idaho Caregiver Navigator program, again, on outcome 3.8. Family caregivers have the skills and tools necessary to prepare for the future needs of the person they support. 3.9 is all about the workforce. We know that is a very popular topic, and there's been a lot of great work and I think ongoing interest in trying to make sure that there is an agile, flexible, and well-trained direct care workforce available to partner with and support family caregivers. So we've got the respite training, respite care registries, the pilot that we talked about earlier that several states have been working on around provider training and recruitment. I imagine there may be some other things that either are happening or you're thinking about in your states, knowing this is such a big issue. So I anticipate we will come back to that one in particular and keep adding and brainstorming how we can work, just recognizing the workforce challenges across the country.
And I see a big typo there on the on the multiple state effort around training, and that should be ARCH-NASHB and RCAW. And if any of you are not familiar with that initiative, let us know. I can put a link to the information on our website. 10 of you who are out there have participated in the field test, and I think just about everybody knows about it, but I'll shoot you some more information about the pilot if you're not familiar with it.
Okay. And then last one on 310 is all around kinship care and making sure that kinship families and grand families are recognized and supported. We know that several states are using or including these populations in their voucher program eligibility. And I know Washington has the kinship pilot as well. So again, we may have missed something, but it might also be listed in another outcome. Okay. Goal 4 is all about financial and workplace security for family caregivers. We weren't sure of state examples on 4.1, so please let us know what we may be missing here. This one is family caregivers can provide care without negative impacts to their near and long-term financial health. I think this one is also a little bit vague, but certainly if you're doing work that you feel like connects to this, please let us know.
And I think certainly if we talk about respite, talk about this issue in the context of respite, it's just about anything you're doing to make respite more available will certainly help reduce negative impacts to long-term financial health for family caregivers. If they're doing well, they'll be able to better participate in the workforce or feel supported in the workplace.
Yeah.
4.2, family caregivers have access to employee-centered, flexible workplace policies and practices that support work-life balance and professional performance when personal circumstances change. We heard a little bit earlier about some of the work going on with employer engagement. Again, I feel confident in saying this is probably not fully comprehensive because we know this is a very popular topic.
Nick, are you able to hear?
Oh, thank you, Lita, for that addition about Arizona and your family caregiver reimbursement program. We will get that added. 4.3, family caregivers have access to and use of financial education and advanced planning tools. Again, self-directed respite voucher programs are being implemented in quite a few states, or direct reimbursement programs to help family caregivers actually pay for respite. And then the last one for 4 is long-term services and supports are more affordable, allowing family caregivers to reduce their out-of-pocket costs. So I think, again, to go back to Jill's comment, like putting your kind of respite lens on that, but what else is happening in your state, recognizing that's a bigger issue that you're seeing respite connections to.
And certainly we could put all the voucher programs into this.
Absolutely. The voucher's good in a lot of these. Okay, we are almost through with one more goal, and this one we really want to hear from you. So goal 5 is all about expanding data, research, and evidence-based practices to support family caregivers. And we wanted to get your thoughts on like what's helpful to you in terms of how we talk about this goal in this group. There's, you'll see in 5.1, for example, it talks about a national infrastructure. Obviously, states play a role in creating that, but that's a pretty big nationwide initiative that could be developed. But and Jill, I'm going to hand it to you in a second just to talk a little bit about some of the work that Arch has done around research, but wanted to just get you thinking both today and in future meetings about where are there opportunities that maybe your state has kind of tried to get into the area of data collection. We know, of course, you're collecting data for all of your funding sources, but where do you kind of see state roles in, national conversations about data collection, research about respite? We know that's an area where there's a lot of opportunity, as well as evidence-based practices. So this was admittedly probably the hardest one to fill out, and would really welcome your thoughts on like, how can we have a conversation about this one that feels helpful and applicable, given your work at the state level. Jill, I don't know if you want to talk about your work with Arch a little bit.
Yeah, I just wanted to make sure you were all aware of the fact that we have convened an expert panel again around the advancing of research evidence base for respite through our Committee for Advancement of Respite Research. And they're working on, much larger, broader goals, but hopefully we'll develop some products that will be helpful to you as well as you advance respite research, or even enhance your performance measurement and evaluation activities at the local level. And then through our innovative and exemplary respite programs, and of course, all of you, if you have your own innovative and exemplary respite services that you want Arch to recognize, we hope that you'll respond to the call when we submit that again this summer. But what we're doing right now is to award research mini grants to 3 of our innovative and exemplary respite services that have been previously recognized, to engage in some more rigorous research and evaluation, to develop a more detailed and enhanced evaluation plan, and then to meet in a learning community over the next year with our evaluation experts here at Arch to help develop that, again, with the goal of making these services more replicable, being better able to document the benefits to family caregivers, and improve the quality of the services that they're providing. I mean, that's really the purpose of doing research, is to gain more information and to be able to replicate services. And, as Wendy emphasized in her presentation last week, to be able to scale up. We can't really scale up until we know what works. And through these innovative and exemplary respite services, it's a small way to work with community-based programs to begin to build the basis for an evidence base. But so we're working from the top down with researchers in the car, but also working from the bottom up with local, innovative, and exemplary services that can also contribute to the evidence base for respite. And we look to all of you to participate in that effort as well, either through identifying your own services or maybe partners within your network that you know might qualify to be recognized as innovative and exemplary. And we'll continue to work with them to make them research ready also. To be programs that maybe researchers would be more interested in partnering with, to identify what are the components of this respite model that make it work. We know so little about what is it about respite that actually works, and which models work better than others, and with which populations, and how much respite makes a difference. So many questions we still have to answer. So we hope that working with all of you will begin to deal with all of those questions.
Absolutely.
If you have any great ideas about things you might be able to do in this space too, we'd be very happy to discuss those here, talk with you about them.
Absolutely. I think this may very well end up being kind of a focus for one of our future discussions. You'll see in the right column, this is one area we did put a note that we know some of you have relationships with universities or other research organizations and settings. And so kind of want to create a little space in this group to be thinking about, are you already collaborating with them around some research, or are there opportunities for you to do that, and what might that look like? So we know that there's a lot of opportunity in this goal, and want to make sure that for states that feel like this could be of interest to them, that we've got some time to talk about what that could actually look like.
Yeah, I'll just add, this one's so important that we have better data around respite care. And so I'm just wondering, so many of you, your states are, like Dina was talking about, are participating, or going to be having a multi-sector plan on aging, and all of your states have state plans on aging. And so I'm just, wondering, is your program, does it feed into, do your numbers then feed into those initiatives so that they're all linked? And then over time, they can track, number of caregivers that are getting services.
Thanks, Wendy.
We also know that ACL will be releasing a more improved data collection plan. I really have no idea exactly what will be included in that. But as lifespan respite grantees, you will be required to collect a little bit more data on your lifespan respite services that hopefully will feed into something larger.
That actually speaks to Lisa's question in the chat somewhat. She asked, with the progress reports that are submitted to ACL, is any of that compiled into like kind of a comprehensive picture of the respite programs?
Yeah, unfortunately not currently.
Okay. But
as ACL works to develop this data collection plan, that is a new intent. And it could be that even with these new grants that are awarded this spring, at some point, there will be a requirement to start collecting these data.
Perfect.
I just am not in a position I don't have enough information to share it with you, but when that gets closer, I'm sure ACL will be sharing that information.
Great. Okay, I think if you can just scroll down just to those questions for the group, we can run through those real quick. So these are going to be things I think for you to just keep thinking about as we go back to this document, and we'll provide updated versions of this after this meeting. And again, like this is going to be a living document for a while. But as you think about activities that we maybe missed that you would like us to include, also think about, are there activities that you're currently doing or plan to do in the near future that maybe don't align exactly with some of these outcomes? I think you saw a few examples of us kind of trying to put the respite spin on some of these and fitting them in. But we talked about like healthcare and partnering with healthcare is a common effort across states, and that they just don't always fit exactly in. So we want to make sure if there are things that you feel like this is really relevant, we will figure out how to fit them in. So again, the more the better in terms of information that you want to share with us, we will figure out where it fits. But if you've got something that you're like, I'm not sure what goal that is or what outcome, if it feels like it's important for us to know, please send it along. And you can email that either to me or to Jill. And again, we'll continue to come back to this document and really use it to help kind of guide our conversation moving forward about what else do you want to be doing in some of these areas. So with that, I would like to go back to our last poll before we wrap up. We just threw an awful lot of information at you. So thank you for bearing with us. And we are now working on like, how do we give you the time that gets you the most out of our next several meetings. And so this question will help us answer that. So if you can, please select the top 2 goals that you're most interested in focusing on this collaborative. That doesn't mean we won't get to others, but we want to make sure that if there are things that you really want to know more about, that we are responding to that.
And please only click 2.
So
You're talking.
it might be tempting to click 5.
It allows you to click as many as you want, but please just click 2 so we can really prioritize to get this group going. People are changing their minds. Okay, I think just about everyone's voted.
Okay, perfect. So I was actually pretty close. Goal 3 is the winner. Goal 3 is strengthen services and supports for family caregivers. And then goal 5 actually, and then 1 and 2, or 1 and 4 are tied for third. So this is very helpful. Again, we will try to cover as much as we can, but there's so many different topics that we could spend our time on and have the hard task of trying to prioritize. So I think this will help us do that. Okay. I know we've got just a couple minutes, so I think we will start wrapping up. Our next meeting is going to be April 20th. We had originally thought we might move it up earlier in the month, but realized that just doesn't make sense with holidays and other things going on. So it will be April 20th. We'll get that invite out to you shortly. I know they haven't gone out beyond March, so watch your calendars for that. And just as a reminder, we will, we've been taking notes, we'll get notes out to everybody, but if you think of ideas that you want to put down for future presentations or discussion topics, we do have this Jamboard that we created last month. You can just click into that link and add a post-it. If you're not familiar with that program or having trouble and you want me to do that, feel free to email me directly and I will get it up there. But we will likely use that Jamboard a little bit more in future meetings. So just want to get people familiar with that. That's all I have. Jill, do you have anything else before we wrap up?
I don't think so. I just want to thank everyone for hanging in there with us. And I hope this exercise today was helpful to you to really get us to be thinking about where do we go next and how does it fit in with how you write your next lifespan respite funding, respond to the funding proposal. And again, I think it might be helpful if you all shoot us an email. If you heard of something today that you really would like to hear more about, that we might bring in an outside expert or look to some of you as experts to present about at the next collaborative, that would be really helpful. I think, Megan just talked about that. You can add that to the Jamboard or just email that to one of us.
Great.
Anyone have any last comments or questions? Sorry, Megan, I didn't mean to cut you off.
No, not at all. Not at all. No, I just want to say thank you. Thank you again for your time. And yeah, we'll see you again in a few weeks. So take care, everybody.
Thank you, everybody.